tissue is right here, and I'm going to pull that tight. That allows me to sink in and drag through. I'm going to sink in and drag through. And this will get red pretty quick, but you can push this a little bit more because it needs it. Instrument's going to really tell us where that scar tissue is, so we get some lotion in here to get some slide on the skin. Now, the more superficial it is, the more tension we're going to put on the leg. So the more bend, the more that's going to open up. So essentially what you're going to do is you're going to go down here and hold distally. That's going to allow everything to relax, and then you're going to be able to get in here and sink in with the instrument, and you're going to pull through, and you're going to try to find the area that is the most gritty. And I found a pretty good spot here, and I found another one here. So, and I'm going to go through and pull, depth, back off, pull through, depth, back off, pull through.